Welcome back to Simply Women's Health with CJ. Today we're going to talk about yeast infections. Yeast is actually a very common diagnosis or common complaint that brings women to the gynecologist's office. So we actually do see it a fair amount. First things first, yeast is not a sexually transmitted infection. It is an overgrowth of a very normal thing that's found in the body. We all have some yeast, we all have some bacteria that lives in our vagina. And then we have lactobacilli. Those are the good guys that keep everybody in check. The lactobacilli are very dependent on balanced pH. When the pH gets unbalanced, such as if you have been on antibiotics, if you have a lot of sugar in your diet, especially if you are a diabetic or a pre-diabetic, if you are pregnant, if your immune system isn't working as well as it usually does, if you have an IUD. Those are all things that can throw off the pH balance, causing the normal bacteria to die off again, and that creates a breeding ground for yeast. So how do you know you have a yeast infection? Your discharge can be thick and clumpy and look like cottage cheese. You typically have itching. You itch really, really bad internally and sometimes externally. Your vagina can be very tender or painful. You can have burning when you urinate. So if you have those symptoms, you probably need to make an appointment with your provider to be seen. You're going to come in, they're going to want to have a good thorough history. Again, what are your symptoms? How long have you been having symptoms? Have you recently changed any of your personal products, your soaps, detergents, fabric softeners? Are you at risk for a sexually transmitted infection? Have you used any over-the-counter products such as like a yeast cream that you can buy at the drugstore? Those are all things that they're going to want to know. After they get their thorough exam, they're going to want to do a speculum exam. So your provider is going to put a speculum into your vagina. They're going to open it up. They're going to take a swab, just like this. They're going to go in and they're going to collect some of that vaginal discharge. And they will either send it off to the lab or they will look underneath the microscope to see what you've got going on in there. If you are diagnosed with yeast, your provider will prescribe either a pill or they will prescribe a cream. The cream goes up into your vagina at night before you go to bed. There's a 3-day treatment and a 7-day treatment. Both are equally effective. So what are some things that you can do to prevent yourself from getting a yeast infection? First of all, don't wear underpants to bed. Yeast loves a warm, damp environment, and so as much air as you can get to her down there, the better. If you are diabetic, pre-diabetic, if you have a family history of diabetes, if you're at risk for diabetes, really be careful about the amount of sugar that you eat. Some people swear by probiotics. The studies have not panned out regarding probiotics for vaginal health. We know that they help with your gut, restoring a normal, what's called a biome in your intestines. They have not found that it helps within your vagina. That being said, if you're a person who gets frequent yeast infections, some people swear by probiotics, and I say if that works for you, then by all means use that. Hi, if you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement for a visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.